and thank you for joining the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a professor in the Medical Education Research and Development Unit of the Faculty of Medicine at the University Malaya. It is 9 o'clock in the evening in Kuala Lumpur, and Dr. Aprajita, who's part of ECHO, is the production in New Delhi. Wherever you are in the world, welcome and thank you. Very simply on this platform, it is a Zoom platform, and I do welcome the dialogue and especially the fact that I can see and talk to you. You're very welcome to interrupt at any time, but what I do ask is please could you keep your camera off because I need to see myself on the screen, not to see myself, but to be able to position the models that I am going to demonstrate to you. I welcome interruption. I welcome comments. Do put up your hand or put it in the chat. Dr. Aprajita will interrupt. But if you've got a burning question too, please ask. This is for you and not meant to be a didactic one-way traffic. So we're going to go back a little bit, and you'll realize that what I'm trying to do is build up the various principles that will get you stitching with more accuracy and more certainty and more reliability. We started with the way we stand, remembering that standing at the table incorrectly will result in musculoskeletal degeneration, and we're not very good at teaching posture among surgeons. We also then went on to point out the way we hold instruments. Principle is to maximize the pulp of the fingers with the instrument. This is the most sophisticated grip of Homo sapiens and enables you to feel. And the secret about surgery is feeling. And therefore, when we hold the instrument, we encourage you to palm the instrument a bit like holding a screwdriver, because we demonstrated when you rotated a screwdriver, pronation, supination, you have about 270 degrees, as opposed to a limited pronation and supination when my fingers are placed through the rings. We therefore place the needle holder in our hand along the axis between the index finger, middle finger, and the common flexor origin. The shoulder girdle, being suspended on the skeleton, enables you to abduct, elevate, pronate, and extend. But in all these positions, you will also realize, using a screwdriver, we're able to fold the radius over the ulna in perfect pronation, supination. That's what makes us human. 90 degrees this way and 90 degrees that way. And why this clean rotation is important is if the needle doesn't go through the tissue cleanly, you end up with space between the thread in cardiac surgery and vascular surgery, but the microabscess in general surgery. The idea, therefore, is for your needle to go through the tissue cleanly. And we cited the Chinese diving team that got the perfect 10 in the Olympic diving because they entered the water without a splash. And that can only be done by 90 degrees. We also said last week that 90 degrees is the perfect angle, as described by Euclid, the mathematician from Greece, because every angle that is opposite is equal at 90 degrees, which is good news for the trainer and trainee, because your alignment of the needle needs to be 90 degrees to the tissues. We also indicated that taking the needle like that and trying to pass it to the tissues, and I'll take you overhead to demonstrate. you can see that this is not aligned at 90 degrees to the table. Perfect alignment is on the halfway at the tip, no space between the tip and the shaft, and that's angled out. And that angle equals the displacement of the wrist from the elbow. Now, the belly hits the table cleanly. As you can see there, it is not rotated like that. The alignment, we said last week, is 90 degrees across what you want to stitch, 90 degrees into what you want to stitch, and rotate. Remember that as we did this, we lined it up, and the alignment's important each and every time. As place, pronated back to point, but as we did that, we unlocked the needle holder simply by abducting the eminence, pointing it into the tissue, and cleanly rotating round. There was a lot of maths in physics I described with this, with parallel lines. And that is important and part and parcel of the practice of surgery. And many people in sport use lines to line the hips, to line the shoulders, to line the body, to line the aim, no matter what sport. And we did ask you, how many of you played sport? We also asked, how many of you play instruments? And then when you think about it, if you want to be good at sport and you want to be good at the instrument, you'd practice regularly because you know practice and purposeful practice makes for better performance. So in mathematics and physics, we refer to the term vector, and this is a quantity that cannot be expressed by a single number or scalar entity, or to elements of some vector spaces. They have to be expressed in magnitude and direction. Now, historically, vectors were introduced in geometry and physics, typically in mechanics, for quantities that both have a magnitude and direction, such as displacement, forces, and velocity. And they were represented as geometric vectors, in the same way as distances, masses, and times are represented by numbers. Geometric vectors can be added and scaled, and these vector operations lead to the concept of vector space. And a vector space is formed by geometrical vectors and is referred to as Euclidean vector space. And they're called coordinate vectors. And in mathematics, physics, and engineering, a Euclidean vector or spatial vector is a geometrical object that has magnitude or length and direction. And it's that magnitude and length and direction that actually applies to what we're doing when we operate. We're applying a direction, we're applying a magnitude, and we're applying a force. And these Euclidean vectors can be added and scaled to form a vector space. And it's depicted classically and graphically as an arrow connecting initial point A with a terminal point B. And the term vector is needed to carry the point A to point B. Literally, in Latin, the word vector is carrier, and was first used in the 18th century by astronomers investigating the planetary revolution around the sun. And the magnitude of the vector refers to the distance between 2 points, and the direction refers to the direction of displacement between A and B. And that's where I say the displacement between your wrist and the elbow. So vectors actually play an important part in physics. The velocity and the acceleration of a moving object and the forces acting upon it can all be described as vectors in 3 dimensions. Many other physical things can be thought as vectors as well, and most of them don't represent distances, except, for example, position or their displacement. They can all be represented by a length and a distance. And we use a coordinate system to describe those. So in the natural sciences, a vector quantity, also known as a vector physical quantity, or physical vector, or simply a vector, is a vector valued physical quantity. Yeah, it all sounds like it's vector quantity vectors, but it's typically formulated as a product of a unit of measurement and a vector numerical value. For example, the position vector in physical space that we know refers to aeroplanes in the sky is 3 Cartesian coordinates in SI units of meters. Think about it. When we're stitching, we are moving our needle around in 3 dimensions, all with direction and coordinates. Then you can, of course, put time into this. And it is sad when I think that many of OSAT schools have actually included time as an endpoint in stitching. I do not teach time. Yes, I'm a cardiac surgeon. Yes, we need to operate and be expeditious, but that does not mean that we need to focus on time. What we need to focus on is quality. Time will come once we understand how to operate and how to stitch. The cardiac cycle, systole, is fixed. It's the same for you and me, putting a needle through the tissue, through an expert and a trainee putting a needle through the tissue. The action is systole. But the part of the cardiac cycle that shortens as the heart rate increases, as you've answered in the question, is diastole. So as the heart rate increases, the lovely flow and rhythm of the heart, atrial ventricle, atrial ventricle, atrial ventricle, maintains. It's just a bit faster. So that is where the setup comes in. Because I don't think we're teaching surgery correctly. We need to focus on the setup. And when you learn the setup, you can move from one stitch to another, understanding your angles and setup in a fluid motion. And that's where fluidity comes in. Because an operation that's fast is actually smooth. There's no hesitation, deviation, interruption. There's a simple progression with movement and flow. And that is not unlike what I'm being taught with the katana, is that the movement from the Nikitsuke, moving the blade forward, bringing it back over the head, and down in one movement is all one. And in fact, the martial artist can do that in a heartbeat, in one fluid, uninterrupted motion. That is not speed. That is joining the dots. That is understanding the vectors, where you began, where you end, where you set up, and where you're looking at it in a 3-dimensional plane. So in natural sciences, the term vector quantity encompasses vector fields over 2-dimensional and 3-dimensional planes, such as the velocity of the wind over the earth. And that's why I think vectors actually provide a concise and synthetic way of looking at not only systems in physics and geography, but also in studying how needles move. So, ladies and gentlemen, I'd be grateful if you could keep your cameras off, because I will be demonstrating some models. And what happens is we share a screen and I can't see the models. I'm very happy to take questions as we proceed. So I use the word namaste here. And if you look at it, my fingers, 1, 2, 3, 4, 5, are lined and I'm touching each side. And your needle going in and out of the tissues needs to go equal and opposite all sides, because it isn't equal and opposite. The first thing that happens is you get a dislocation like that. And if it's not equidistant, and if you put your hands together and look at the creases in your fingers, if they're not aligned and not equidistant, you end up with a slip. And the common problem with continuous stitching is that we end up with a dislocation and we end up with a slip. And this really is a deconstruction of all stitching, but of skin stitching in particular. Perfect alignment, equal and opposite, avoiding dislocation and avoiding the slip. So what model do we have or can we use to demonstrate that? Now, the banana has become synonymous with the Black Belt Academy. Why? Because we have put the banana through a CT scanner, and the Hounsfield units of the banana skin and the flesh are not too dissimilar to human tissue. In fact, the same. And everybody is using suture pads. And we put suture pads through a CT scanner, and they're extremely dense, made of polytetrafluoroethylene or silicon products that actually grab the needle and make it difficult to rotate the needle through the tissue. What I've done here is I've made a linear incision in a banana and made 5 perpendicular marks across. The exercise here is place your needle 90 degrees across what you're wanting to stitch. I'm just going to increase my screen size so I can see this. Excuse me one moment. I've got an annoying setup issue here. So I am going to place my needle 90 degrees across what I want to stitch. I'm now going to rotate the needle backwards.
Prof. David, can you please zoom out a little bit?
I beg your pardon?
Can you zoom out a little bit?
I'll zoom out a little bit.
That's it. That's it. Yeah.
I'm just trying to. Okay. I'm just trying to maximize my screen.
It's perfect now because we were not able to see.
And I have just lost my screen. How about that? Excuse me a moment. I've just lost my screen. Are you still there? See this banana? I've made a linear incision in the banana and made 5 perpendicular marks across this. Last week, we just used a potato and 1 mark. So therefore, place, rotate it back, point into the banana, and we rotate it through. And what we want to see is it come out on the line. But that distance is not the same as that distance. So therefore, we do this again. Every time we consciously align the needle, place it in the right place, and rotate it through. That is better, but not perfect. And we do that again. So once we've got our alignment correct, we then move along this linear incision and do it with each of the stitches in each position. Equidistant either side. I've just come off slightly off the line this side. But all of this alignment is helping me think about my needle rotation and needle placement. This is the surgical vector that I'm talking about, equal and opposite. In, equal, and opposite. So I'm slightly further away this time, and I'm off to the right. Your suture pad model will not give you this feedback. And we also know from the evidence and studies that the banana gives better feedback. There you go. Too close, too far away. That's going to be a slip. We need to do that again. The models that we use in the Black Belt Academy are not supposed to be easy. They're supposed to tell you when you get it wrong. There you go. Equal distance both sides. Pick it up. And to reiterate that the tissue holds the needle in the right position. I'm therefore able to move it to just beyond the halfway, apply my needle holder, continue the delivery of the needle out of the tissue, continue it on the rotation. Place, point, rotate. Place, point, rotate. We've come off the side. There. This simple exercise, up and down, is important because what I've noticed with people doing continuous sutures, they're more focused on the action of stitching rather than on the setup. Drawing the lines enables you to think about the setup and think about the placement. And it's this position that is important when practicing and rehearsing any movement, whether you are an Olympic sprinter, hurdler, jumper, swimmer, martial artist. Every sport will focus on the position and setup before power and zen. When the two edges are now separated, like that, the 90 degrees to that side is that vector, and the 90 degrees to that side is that vector. You can't go through there, keep the needle in place, torque it round to go through the other side. Those two vectors are totally different. And therefore, one of the common problems we see, particularly when stitching skin, we mentioned last week the problem of the forceps grabbing the tissue and causing damage. And what people do when stitching skin, they lift up the tissue, grab it, and cause damage. But lifting that side, you're now separating the two edges. Plastic surgeons use skin hooks, as we have got here. So we're going to lift up the edge, and because I've lifted the edge up, the two sides are not together. So I now need to take my needle into the lumen, and two goes. Pick the needle up, and lift the other side, and make sure I come out equal and opposite. Two slightly different vectors. The problem is when people are stitching, they'd come through this side and then torque it through and try and force it through the other side. We can immediately see there the damage on the skin, and pulling it out, one can see the tear. And we'll come back to look at these because the banana with phenol oxidases in the skin, these darken over time. So once you are happy going in and out on the line on 5, but like 5 fingers, on the other side of the banana, let's make it a wee bit more difficult, shall we? This time, rather than drawing lines, we're going to practice using dots. Can we come in on the dots? And this is where it's important that you align the dots correctly. In on that dot, out on that dot. Deliver the needle. And out. place, point in on that dot, out on that dot. Okay? So I'm effectively, with the alignment, allowing the needle to do the work for me. Now, the size of the needle is really dependent on the thickness of the tissue and what you want to stitch. But you see here that I'm actually using the diameter of the needle on the dot, out the dot each time. Place, point, and rotate slightly off the dot. And once you are happy doing that, it's a bit like riding a bicycle. You remember learning to ride a bicycle when you're younger. You can then start taking the stabilizers off and see if you can do this yourself without any dots whatsoever. The distance, that distance there is x. That is x, and that is 2x in essence, two creating squares. But effectively, place, point, rotate. If we zoom down, you can see that a clean rotation of the needle leaves a single punctum or hole. Whereas if I do not rotate the needle properly, if I grab this or pull it out with my forceps, you can immediately see that is a tear. We go back this side. The blackening is quite obvious. You cannot see or get this feedback on a suture pad. And that is why the banana is useful. But there's another dimension, of course, to rotating a needle. Here, I've boiled an egg. What you've seen on the banana is called the exit points. But we've also said it's important to rotate it perfectly into the tissue. So this is what I call a second Dan exercise. We're placing the needle into the space between the yolk and the white. And we need to be able to rotate the needle out of the tissue without actually, see that? I've pulled it through and you can see the needle rotating backwards and the heel of the needle catching. Now, if you're working in a tight space, like in a mouth or down a deep, dark hole, if you're not cleanly rotating your needle through the tissue, the back end of this needle in itself would cause damage, and you will find yourself in problems. So the idea is to be able to take your needle in and out of the egg without tearing the egg, delivering the needle cleanly, without letting it swing back and scrambling the egg. These are not meant to be easy exercises. These are meant to be exercises that require you to think about the rotation of your needle. Because if you don't cleanly rotate the needle, as we've drawn, you create space. What happens when people are practicing up and down, and certainly in a continuous stitch, and when we're watching people stitch, we don't actually watch their setup every time. So this simple exercise we'll be trialing and practicing in the faculty. But I think, as I'm doing a systematic review of OSAT scores, where they're looking for fluidity of movement, and some OSAT scores include time and have failed people for not completing it on time, I think that is silly. Because what I am looking for is accuracy and perfect apposition. Because if my stitching on a coronary vessel, which is 2 millimeters, is not perfectly accurate, then I'm going to get clot formation and my anastomosis. will not work. As I said to my trainees, getting a patient off bypass is de rigueur, is fatal. We need to just be able to do that. What I expect is an anastomosis that's going to last at least 20 years, because that was 20 years of practice, and I didn't have to redo a set of grafts. In a linear incision, going up and down like this, one's in a relatively neutral position. In a relatively neutral position. I'm not having to move my feet or move my body. However, if the incision was longer, I would have to start moving. And the thing about the banana I want you to contemplate now is the vector there and the vector there. If I put two instruments at 90 degrees across there and draw it back, that subtends an angle of about 85 degrees. You cannot stand in that position, in one position only, and attend to that vector and that vector. They're totally different. So I want you to think about how you stand when practicing this. On this hand, I'm standing more on my left foot and rotating round and rotating out on the line, equidistant either side. I do not, or try not, to actually pick it up by the point, because that is the no-go area of pickup. Rotate the needle out cleanly. Now, if I maintain my left hand standing, left foot standing position, and I try and put it in this position, it feels very awkward indeed. And therefore, across to the side, I need to have changed my weight distribution. Now it's to my right leg. So making the decision this side of the banana and making it this side of the banana and swapping between the two to get my needle alignment, I am moving from my left foot on this side to my right foot on this side. And this will become more apparent as we move forward in our next episodes of stitching. Left foot, and right foot. Please note that I'm not using my forceps to deliver the needle. The needle is being held in the tissue in the right plane, and it's true for most tissues, 98% of the time. The only time I had to support my needle to pick it up was in the right coronary artery and the right atrium, both of which did not have much in the way of substantiated tissue to actually hold my needle. So this is an advancement on your linear stitching, getting you to think right leg, left leg, not necessarily stepping, simply adjusting your weight distribution. 85 or 80%, 20% tilts the pelvis. So when it comes to when the two edges are separated, much like I lifted the edges of the skin incision here without picking them up with a forceps, recognizing that the two edges are separate, that the vector that side and the vector that side is different. You can imagine when we have this sort of incision that most vascular surgeons would recognize, that we have at the proximal end a heel and at the distal end a toe, heel and toe, heel and toe. And if we think of the vectors at the heel and toe here, 90 degrees is there. 90 degrees is there. Okay? On that vector. And you can go along and draw your vectors along the incision, but you can see those are not lined up. So it'd be inappropriate if the two edges are not sitting together for me to take the needle through there and then force it round and try and take it through that side. I've immediately torn the banana there. It's given you that feedback. I even heard a tearing sound. I need to take it through that edge, pick it up to this edge. And remember, I'm taking it through the edges and I'm not touching the banana flesh itself. The secret is proximally is the heel, distal is the toe. So where is the vector? Exactly at the toe and at the heel. Well, this is easy because 90 degrees you'll find is parallel to the two walls of the vessel. And this enables you now at the heel and toe to think about how you line your needle, and that is straight down the vessel. The other little secret for heel and toe stitches, because everybody is worried about picking up the back wall, is to hold the needle a little further back. And that belly bounce I showed you there, where the belly is at 90 degrees, and I use this in coronary surgery, that belly I can use to push the posterior wall away. You can see pushing the posterior wall away, my hand, I can push it on, slide it under the anterior wall, and the recoil for the posterior wall brings my needle up 90 degrees through the anterior surface, anterior wall. The thing is that people are so worried about hitting the posterior wall that they're coming at it funny angles, and at that angle is going to hit the posterior wall further down. So this is understanding your anatomy of the needle, using it to push the posterior wall away and bring it up through the anterior wall.
Prof. David, we have a question from Jamshed.
Please,
How
fire
can
away.
the question is, how can needle rotation will get you equidistant from our incision site?
How can what? Could you say that again, please?
Yes.
Could you ask that again, please?
Yes. Give me a second. His question, needle rotation will get you equidistant from our incision site.
How does rotation get you
Yes. How can
equidistant?
needle rotation
Well,
will get you equidistant from our incision site?
the rotation is really, and the depth of the rotation is dictated by how high above the suture you start, above the tissues you start. If you start very high, you're going to have a shallow rotation. If you start deep, you'll have a deeper rotation. But effectively, with all the rotations, what I hope I'm showing you is I'm using the diameter of the needle effectively. So this is where your choice of needle is actually important. I'm coming from inside out on this side, but from this side, can I come from outside in without picking up the banana? And there you go. So therefore, I'm controlling my needle rotation through, and I'm not touching the banana and coming out that side. So this is where these models give you the opportunity to practice your rotation and equidistance. And the haptic feedback from the banana is not too dissimilar to the haptic feedback that I'd get from an aortic wall. Picking up the edges. And I'm not disturbing the flesh of the banana at all. What I'm trying to do is I skidded it in there, you can see, but that's a clean entry, and that's a clean entry, that's a clean entry, and those are clean exits. So the whole idea behind all of these models is really to get you to practice and to think about your accuracy of setup in the vectors, because there's no speed involved here at all. Once you understand the setup, how to pick up the needle, how to align the needle, and you practice that simply on a banana by drawing the lines, you will hardwire it in yourself. As I said to you before, just look around you. Look at the ceiling, look at the floor, look at the table, look at the computer screen. You are surrounded by 90 degrees. And if you go back to last week's lesson, I gave you a file with 20 slides on it, from 86 degrees to 94 degrees. And I have no doubt, indeed we have published, that 90% of you plus will be able to spot the 290 degrees. And this is great news for teaching you how to stitch, because that alignment is mathematics. That is vectors. All you need to do now is to work out what position you need to be in to effect a good stitch. So as we did this, we determined from that side to that side, the vectors subtended an angle of 85 degrees. And to ensure that I was aligned properly, I had to change my body position. But it all comes down to posture as well, because we also said in the beginning, if you start supporting your scapula out laterally, you've got 17 muscles in each scapula. That becomes tiring. And really what one should think about is when operating is keeping your elbows by the side. So when I'm turning to my right leg, I'm actually turning my body into my abducted shoulder to minimize the abduction and the contortion that I'd otherwise have to get into to effect a good stitch. I hope that makes sense. I'm very happy to take questions. I hope I've given you an idea on how you can practice this at home. This is not going to happen overnight. One has to go through it step by step by step by step. And next week, we'll take this movement one step further and then think about how we make a circle. What's interesting doing my systematic review at the moment of OSAT scores, that time is always included because that's a scalar measurement. We can put a quantity to that. But most others talk about lightness of touch or fluidity of motion. Well, I hope I've dispelled this fluidity of motion by saying, actually, you've just reduced the diastolic interval because you've focused on your setup. We now move seamlessly from one action to another, like the sword going from the cut back and over the top in one beat. So your needle does the same. It's set up, stitch, set up, stitch, set up, stitch, until the setup is so hardwired you can move from one angle to another in a fluid motion. And that's essentially what they teach in martial arts. You learn a motion, you put it together with another one, then you've got a combination. What's also interesting, even when you are tired, been in theater 23 hours doing a dissection, the aorta is wet, soggy tissue. And if you start taking a needle through wet, soggy tissue, tearing it like you do a banana, you're going to end up with persistent bleeding. When you're tired, when you're exhausted, what you need is a solid foundation on basic skills that you can rely on again and again and again. And that's why we practice, not until we get it right, but until we cannot get it wrong. Richard Resnick's paper back in 1997 actually had 28 elements to this. which I haven't seen in any other paper on OSAT scores previously. He described a needle going in 90 degrees 80% of the time. He described the needle being accurately rotated. He described the needle equal and opposite. That is what we need to get a perfect join. Those elements, I think, need to be reinvented, and we need to think about how we teach and practice them. Of course, at the end of all of this banana is edible. So what we're dealing with is sustainable surgery. You can't eat your suture pad, can you? And after this, you're feeling a little bit tired. So why not? Thank you very much indeed for your attention. I'm very happy to take questions from anybody and everybody about what we have discussed, and very happy to be challenged in the thinking. Thank you for attention, and thank you to IECHO for the support, Prof. Moati, Prof. Zaleha, Dr. Jeffrey, and Prof. April for your enthusiasm. Much appreciated. Thank you.